Meanwhile, Public Health England has issued a statement within the last hour saying that it does not recommend so-called mixing and matching of vaccines. It comes as the makers of the Oxford AstraZeneca vaccine say they are ready to deliver 2 million doses of the jab each week by the middle of January. That's despite a warning from England's chief medical officer about shortages. Well, and today, Pfizer has also said there is no supply issue with their vaccine. But new government guidance suggests that if supplies run low, vulnerable patients going for their second dose could be given an injection of a different type to their first. Well, the government's Green Book on immunisation against infectious disease says for individuals who started the schedule and who attend for vaccination at a site where the same vaccine is not available, or if the first product received is unknown, it is reasonable to offer one dose of the locally available product to complete the schedule. This option is preferred if the individual is likely to be at immediate high risk or is considered unlikely to attend again. Well, Sky's Adele Robinson joins me now. It's all quite confusing, isn't it, Adele? Because you get the pharmaceutical companies saying, you know, there's plenty of this, there are no capacity issues from our side, and yet it feels like our expectations are being managed, that we might reach some pinch points with the availability of the vaccine.
Yeah, conflicting reports, mixed messages, and overall a confusing picture is being painted here of a seemingly unclear strategy from the government on this. And now this latest news that the UK government appears to have quietly updated its Green Book on vaccinations, saying that potentially vaccines can be mixed, as you say, so that anyone who is going for the second dose, if that dose is not available, the same as the first dose that they had, or their first dose, it's not known exactly what they had, then they will be able to mix. They'll be able to have a different vaccine as their second dose. Now, this flies in the face of guidance given in other countries, such as the US, which states that the different vaccines are not interchangeable. And they're stating reasons of safety and efficacy because they simply have not yet been evaluated. There's even a quote in the New York Times from a world-leading expert in vaccines, John Moore from Cornell University, who describes this from the UK government as seemingly to have abandoned science completely. He says that it seems like they're trying to guess their way out of a mess, in his words. And of course, again, it raises questions over the decision to postpone second doses for those who've already had one dose, their first dose of the Pfizer vaccination. The government stating that they want to maximise as many people as possible getting one dose of a vaccine to give some level of protection. And we have this statement, as you say, from Public Health England released within the last hour, which basically the beginning of it starts to say that it does not recommend that vaccines are interchangeable, but at the end it sort of paves the way for it. This is what it says. We do not recommend mixing the COVID-19 vaccines. If your first dose is the Pfizer vaccine, you should not be given the AstraZeneca vaccine for your second dose, and vice versa. And this is where it changes a little. There may be extremely rare occasions where the same vaccine is not available or where it is not known what the patient received. Every effort should be made to give them the same vaccine. But where this is not available, it is better to give a second dose of another vaccine than not at all. So it does appear to be paving the way in some circumstances for vaccines to be mixed and matched, if you like. And on top of that, we have that confusing picture, as you mentioned. On the one hand, the government is saying that there could be a vaccine shortage. On the other, we have the drug companies saying that that's simply not the case. So whether or not it's a vaccine supply issue, whether or not there are also other reasons, such as a workforce capacity or a mixture of both of them, it's still unclear. There's also some suggestion that red tape's getting in the way of volunteers coming forward to administer the vaccine. And all of this lumped in one is leading to more and more criticism of the government for failing, as it appears to be, according to those who are criticising them, to implement a proper vaccine rollout strategy.